Hello, is it
Hello.
Heather Brown?
Yes, hi.
Hello, I'm Dr. Dorothy Newton, I'm one of the psychiatrists.
Yeah, thanks for seeing me.
Nice to meet you. I understand you're the health visitor for Samantha Lee, is that right?
Yeah, so that's right, so Lady Samantha Lee. I'm worried about her because she's got postnatal depression and she has been being treated for it, sertraline and talking therapy, but she's really gone as far as she can go with the sertraline, and her doctor and her are saying that it's making no difference. She's still feeling really, really low, and I'm just anxious that it's not working, and I don't know what more can be done for this lady.
Okay, it sounds like she's in a really difficult situation and that her depression sounds quite resistant to the treatment she's had so far.
I mean, luckily she's not suicidal or anything.
Good.
She's not, I'm not worried about her in terms of safety, but I do kind of feel it's sad that she's still feeling so miserable.
Of course. So I think it's going to be helpful to have a think together about possible further treatment options for her, which might be helpful. Can I just check, is she breastfeeding at all?
She was, but now she's doing bottle feeding so that her husband can help her, which I think was part of the issue.
Okay. I think to start with, if it's all right, perhaps you could tell me just a little bit about her social circumstances, like who's supporting her. You mentioned a husband, and
she's got a husband, she's got family, so she is well supported.
Yeah.
But she can't seem to shift this low mood, and I'm not worried about her bonding with her daughter. She is.
Okay.
But it's just the fact that she just feels so lackluster, and she's worried that she's still feeling so just down, really.
What sorts of things is Mrs. Lee saying?
She's just saying that sometimes she does say, I think I'm a bit of a rubbish mum because I should be feeling a bit better. But we've managed to challenge some of those thoughts, you know,
good.
So that's good.
Yeah.
And she is aware that that is just a negative sort of, you know, she's had
negative
therapy.
Cognition.
Yeah, but she can't stop herself from still feeling that way, and she's just saying that she just feels really low. She doesn't feel as happy. She still feels tearful,
right?
And she's doing her best, but she doesn't feel like it's good enough right now.
So a sense of not feeling good enough. That maybe she's not a good enough mum.
I think she thought she'd feel happier.
Right. And what about in terms of relationship with her husband? Does she feel like she's doing okay by him? Or?
She's okay, but she just wants to feel happier and back to normal.
Right. What's she doing with her days, other than obviously looking after her little baby? But I mean, was she previously active? Has that changed? Or
she's on maternity leave, but I think she's struggling to enjoy everything. I mean, the only thing she seems to want to do is just be with her daughter, which is great.
Yeah.
But she's just struggling with other things.
So it feels like she's become more isolated, and some of these negative thoughts or cognitions about being a good enough mother have really become very prominent and difficult for her.
Yeah, and I think she's tired, obviously, new baby. I don't think she's sleeping very well or that hungry or anything like that. So I think she's not really looking after herself as much as I would like to see.
So I understand she's on the maximum dose of the sertraline, 200 milligrams, which has been on for a number of weeks now, and it doesn't seem to have shifted the depression.
Yeah, and the talking therapy, which I thought would help. Yeah. I mean, why is she not actually improving if she's on the maximum dose of everything?
Well, sometimes it's the medication isn't right, and we can come on to that in a moment. It doesn't always work for everybody, but also there can be perpetuating factors. And it does feel in Mrs. Lee's case that maybe some of her negative thoughts about herself as a mother and so forth means that she's focusing very, very much on the baby, which in many ways is really good, but might take her away from doing other activities, say outside the house, seeing friends, doing things which she finds enjoyable, mixing with other young mums, for example, and seeing that actually she's not doing very badly at all. So if she doesn't have those aspects in her life, if those have really reduced down, then that can sort of reinforce the negative thoughts and the low mood which she's experiencing at the moment. Yeah. Does that make sense?
It does make sense. I was kind of hoping the talking therapy would have helped with that though.
Yeah. I also just wanted to check also about the move from breastfeeding to bottle feeding. You said that didn't seem too difficult for her. Is that right? Okay, because some mothers can feel quite regretful for that transition, and I just wondered whether that might be adding to her negative thoughts or negative cognitions at all. But it doesn't sound from what you're saying as if that's the case. No. Okay. So there's a number of ways in which we could look at sort of moving her treatment forwards and changing things a bit in hopefully a helpful way.
Yeah.
In terms of medication, she's on the sertraline. I think she's had a full and fair trial of that. She's been on it long enough at the full dose.
She has,
So we could consider changing to another medication, for example, citalopram. Although it's in the same family of medication, it might be helpful. Alternatively, we could change to a completely different type of antidepressant, different family, such as something like venlafaxine or mirtazapine. So there's possibilities there. So that's medication. In terms of talking therapy, clearly, there are other forms of talking therapy available than CBT.
Oh, is there?
Maybe something such as, for example, interpersonal therapy, or for some mindfulness might be helpful to help challenge those really negative thoughts, cognitions that she's having. So those are possibilities. And then there's also what I term the sort of psychosocial side of things, which is about sort of activities and getting engaged more in life and enjoyable things. And there are different routes around this, which you might want to think about with her. For example, perinatal services could be involved in offering something like occupational therapy support. So trying to, as I say, get her engaged in more activities.
Okay.
There may be some some mother bonding work which could be offered to her.
Right.
In addition to that, there are also services offered outside of perinatal services by organisations such as the charity Mind.
Okay.
They can offer mother and baby groups to mums who might have mental health difficulties. And so I think that's an option. Again, she'd be meeting other mums and sort of learning how they're adjusting to life as a mother and how they are coping with everyday life. And again, maybe that comparison could be really helpful to her to see that she's really not doing badly at all in many ways as a mum. So those are some of the psychosocial options, all of which I think are worth thinking about.
So my worry is, because the sertraline didn't work and we were quite hopeful about it, and the other talking therapy, I mean, all of those are great, but if for some reason none of that helped her, what would happen then?
Well, it's not by any stretch the end of possible treatment options available for her. I think that we would need to potentially I would need to meet with her, or another doctor meet with her, just to make sure that we're absolutely correct about her diagnosis of postnatal depression. I wouldn't want that, if these treatments offered didn't help at all, then I would wonder whether it might be perhaps something else like a bipolar affective disorder. So it's just keeping an open mind about what the diagnosis is and, continually reviewing that.
Right.
Additionally, there are other medicines which can be added in, what we call augmenting agents. For example, something like lithium could be helpful in some forms of really resistant depression. That can be very beneficial. In addition to that, one of the other things to think about would be possibly a course of electroconvulsive therapy in really treatment-resistant depression. Again, that can be very helpful, or transcranial magnetic stimulations, another very novel approach which can be of benefit.
Okay.
Finally, she really continues to struggle. There is potentially the option of thinking about a mother and baby unit inpatient admission, just to give her that more intensive support going forwards.
Hopefully we won't get to that, but okay, that's really helpful, thank you.
Okay, thank you very much. As with all stations, there's a huge amount to cover here. It's going to be really important that you take a brief summary history and that you don't focus too much on the precipitating factors. What this station wants you to be looking at is the perpetuating factors. You will need to think about treatment options with the health visitor in terms of the biopsychosocial model and to explore that with them. It's also going to be really important that you remember that you're speaking to a healthcare professional and you're not speaking with a patient here. And that, in a sense, that allows you to use, for example, more professional terminology than you might do otherwise.